The numbers are staggering. Overdose deaths in the United States rose 16% from 2013 to 2014. That has prompted a shortage of mental and behavioral counselors, which is why hundreds of them met with lawmakers on Capitol Hill this past week, pushing them to pass legislation to address that shortage. Becky Vaughn was there. She's with the National Council for Behavioral Health. Joins us now from D.C. Becky, good morning to you.
Good morning, Steve.
We have a lot of people in this country who are addicted to all sorts of things, and when they want help, unfortunately, there's a huge shortfall in the number of the people who can take care of them. Why is that?
Well, there's many reasons. It's like anything else. There are many workforce shortages, but right now we're only managing to treat about 20% on a good day of the people who actually need care. And so as we need to increase that capacity with an opioid epidemic, with the fact that alcohol is still the #1 drug of choice, #1 cause of problems, we don't have the workforce we need. The pay is abysmal. Median salary is less than $40,000. There are amazing superheroes right now working in the communities for little pay.
Sure.
They need more education. The insurance companies are wanting master's level people. On those kind of salaries, you can't go back and get your master's. So we need programs like loan forgiveness. We need to say to our payers, this is a priority, and we need to pay for it.
Sure, and Becky, you just look at the numbers, and I mean, the one you just gave us was jaw-dropping, where only 1 in 5 actually getting the help because of the number of people in the workforce. But look at this, 16 million adults suffer from alcohol abuse disorder, about 2 million suffer from painkiller addiction, and about 500,000 addicted to heroin. Okay, so you went up to Capitol Hill and you said, look, we need help here. We need better, as you detailed a moment ago, loan forgiveness, better pay, things like that. How were you received on Capitol Hill?
I think there's much more interest in all my years of working in this field. There is much more interest, whether it's the overdose epidemic from opioids, whether it's more of a realization that this is a real brain disease, that over 250 people are dying every day from this issue. You know, Steve, that's like a major airplane falling out of the sky every single day.
Sure.
And so it's time to address this. We've created awareness. We've made people understand. But now I think politicians and community leaders are beginning to understand that we have to address this issue, and mostly by making sure that care is available in every single community.
Sure. So I think you've detailed pretty well what you need in the future, but the other component that we haven't talked about is the human element on the rehab worker, because this is a very personal business, and when you apparently what I've read is when you're dealing with somebody in a rehab situation, you take a lot of those problems home with you at the end of the day.
It's a tough job. It is a very difficult job. You're dealing with people who are in a very bad situation with a devastating brain disease, and it's hard, and we need to make sure that we're taking care of them also. We need to make sure we have sabbatical policies and ways for them to help. I'm a former teacher. I know the stress there, but I got great breaks during the year when I was teaching to kind of help with that burnout piece. We're asking the ultimate of all of these folks because we don't have enough people in the field. So I hope young people will realize it's a great field to go into. Amazing what you can do, amazing how you can help people get back into the community and manage this disease. But we need help from the government and in terms of our payers, insurance payers, Medicaid, to pay rates that will allow our providers to pay a decent salary.
Absolutely. There are a lot of people suffering, and we just need more people in that business. Becky Vaughn, the National Council for Behavioral Health. Becky, thank you very much.
Oh, thanks for putting a spotlight on it. My pleasure.
You bet. Sounding the alarm. We've got to.